these finger-like projections that go into the small intestine lumen that help maximize absorption of food. Parvo kills the cells in these crypts that supply the cell line for these villi. And so when these die, all that sloughs out. And you know how you get ulcers in your mouth that are really bad? He's got those from just behind his stomach and all the way to his large intestine. So,
comparing Parvo to a disease that you may get, say cancer, you know, something like that, how serious? I mean, is it?
In the 80s, it was a cat virus that mutated and started forming Parvo.
Really?
In the 80s, when they started getting it, they just died. Nobody knew why. Now we know that if you can keep them alive for the virus will run its course. After a week, they get over it, and then they're immune to it. They will never get it again. It's kind of like chicken pox. The virus itself does not kill them, but because the virus attacks their immune system and their intestinal tract, it suppresses their immune system where it's trying to fight it off. It makes them susceptible to things like bacterial infections. So the bacteria in their GI tract can then cross over into their bloodstream, and they become septic. And then also the vomiting and diarrhea becomes so extreme that they die of dehydration. So if you can, one, keep them hydrated, and two, we treat the bacterial infections for them. If you can keep them alive for about a week, they can turn a corner and go. And that's it. They're over it. He will shed the virus for up to 2 weeks after he's no longer clinical for it. And so any puppies that come to your house from this
Must be
point on
vaccinated.
must be vaccinated.
That's not what happened.
Years from now, say he's gone and you decide to get a new puppy. Puppy needs to be vaccinated. You need to keep it off the ground because it will be in the soil and it will stay there for years. Until you move out of that house, it will be there.
Wow.
He probably was exposed to it just before you picked him up. Anytime you get a dog from the shelter, you've got about a 10-day incubation period. You can break with parvo, intestinal worms, upper respiratory infections, any number of things. Okay. He broke with parvo. My guess is he is partially vaccinated. At some point, he had some vaccines, because not